Only a year after the COVID-19 virus was first identified in Wuhan, China, has gone from being the world's epicenter of the pandemic to one of the countries with the lowest reported infection rates. But alongside this transformation is the Chinese government's lack of transparency and its reliance on censorship and propaganda. China's coronavirus vaccines were supposed to deliver a geopolitical win that showcased the country's scientific prowess and generosity. Instead, in some places, they've set off a backlash. Hello everyone, welcome to World of China. In today's video, we're talking about a very interesting and requested topic. Why do people don't want to take the Chinese vaccines? So stay tuned and hit the subscribe button. Officials in Brazil and Turkey have complained that Chinese companies have been sluggish to ship the doses and ingredients. Revelations about the Chinese vaccines have been slow and spotty. The few announcements that have leaked out suggest that China's vaccines, while considered effective, cannot stop the virus, as well as those developed by Pfizer and Moderna, the American drug makers. Chinese vaccine producers CoronaVac and Sinopharm have signed on to the global vaccine sharing scheme COVAX, which aims to distribute vaccines to poorer countries. The Global Alliance for Vaccines and Immunization, or Gavi, said it would make 110 million doses of the vaccines available as part of the scheme. COVAX has agreements with the manufacturers of 11 vaccines and plans to provide 2 billion doses across the world by early 2022. Both Sinopharm and Sinovac, which have been approved by the World Health Organization, or WHO, for emergency use, are already being used in China and dozens of countries around the world. But what do we know about China's vaccines, and how do they compare to those being developed elsewhere? The Beijing-based biopharmaceutical company Sinovac is behind CoronaVac, an inactivated vaccine. It works by using killed viral particles to expose the body's immune system to the virus without risking a serious disease response. By comparison, the Moderna and Pfizer vaccines are mRNA vaccines. This means part of the coronavirus genetic code is injected into the body, triggering the body to begin making viral proteins, but not the whole virus, which is enough to train the immune system to attack. China's vaccine diplomacy campaign has been a surprising success. It has promised roughly 500 million doses of its vaccines to more than 45 countries, according to a country-by-country tally by the Associated Press. With just 4 of China's many vaccine makers claiming they can produce at least 2.6 billion doses this year, a large part of the world's population will end up vaccinated, not with the fancy Western vaccines boasting headline-grabbing efficacy rates, but with China's humble, traditionally made shots. China's vaccines have already catalyzed immunization campaigns in more than 40 countries. The country aims to produce between 3 and 5 billion doses this year, and more may come from manufacturing deals with other countries, such as the UAE, which is making a version of Sinopharm's Beijing vaccine called HiAdVax. For many countries, Chinese vaccines were the only accessible ones. In others, such as Brazil, Turkey, and Chile, where many tens of millions of people have been vaccinated, they make up some 80 to 90% of doses applied. And researchers in these countries are beginning to see evidence of their effectiveness in controlling the pandemic. More than 80 countries are using China's COVID vaccines, including many in Asia, among them Indonesia, Thailand, Malaysia, Vietnam, and the Philippines. However, some countries that opted for the Chinese jabs have high vaccination rates and are still seeing a surge in infection numbers. For instance, Chile reimposed a curfew and brought back restrictions on traveling in response to the Delta variant, which is more transmissible than previous variants. More than 70% of Chileans are fully vaccinated, most with the Sinovac vaccine. The Seychelles and Mongolia, meanwhile, have recently recorded some of the highest increases in cases per capita despite their small populations. Some Chinese citizens have cited concerns over safety and efficacy as grounds for refusing vaccination. On April 11th, China's leading disease control official said existing vaccines in China offered a low level of protection and that mixing different vaccines was one of the strategies being considered to boost their effectiveness. Thailand has changed its vaccine policy to mix China's Sinovac with the AstraZeneca vaccine in a bid to boost protection after hundreds of medical workers caught COVID despite being fully vaccinated with Sinovac. Meanwhile, in Indonesia, the main Doctors and Nurses Association said at least 30 healthcare workers died despite receiving 2 doses of the Sinovac vaccine. The country is now planning to switch to different COVID-19 vaccines for second doses or administer booster shots to increase efficacy. But it seems that vaccines are not the only factor to explain what's going on in these countries. One reason could be that the efficacy of vaccines might be fading, or they're not as effective against new variants. Pfizer has said recently that it'll seek authorization for a booster shot in the United States to improve immunity. Now, here comes the big question: how effective are Chinese vaccines? The WHO said studies show that Sinovac vaccine prevented symptomatic disease in 51% of those vaccinated and prevented severe COVID-19 and hospitalization in 100% of the studied population for adults aged 18 and older when it approved the jab in June. It added that only a few adults over the age of 60 were enrolled in clinical trials, so efficacy could not be estimated for that age group. According to a study published in the New England Journal of Medicine showing results from Chile, Sinovac has an efficacy rate of 65.9% against COVID-19, is 87.5% effective at preventing hospitalization, and 86.3% effective at preventing death. However, there is little data about its effectiveness against the Delta variant. Still, the mistrust and the dependence of dozens of poor nations on China to protect their populations could set the stage for a major global political headache if citizens offer the Chinese vaccine feel they're being given a mediocre product. China's vaccines were meant to score a clear diplomatic win for Beijing, shoring up ties with dozens of poor nations amid an anticipated shortage of Western developed shots. But there has been little information about how the Chinese versions have fared in final stage clinical trials, with just the United Arab Emirates and China itself supporting the vaccines for emergency use so far. Meanwhile, some US and European companies have published data on the safety and efficacy of their shots and started to deploy them. China may also be overestimating its ability to simultaneously vaccine its own 1.4 billion population and meet the demand of hundreds of millions more in populous developing nations. CNBG said it's capable of making 1 billion doses of its inactivated vaccines, while Sinovac can produce 600 million doses, based on existing facilities and one set to be completed soon. CanSino said it could make 200 to 300 million doses of its viral vector vaccines. If Chinese vaccines aren't available, developing nations will turn to other suppliers, and China will lose leverage. If this happens, then it would be not just about the economic loss. Diplomatic and strategic gains will also be undermined. So, transparency is needed to support more general public acceptance of the COVID-19 vaccines. If global leaders fail to convince their citizens that all the vaccines they approve for use are equally safe, they could face a backlash among those who believe they're being given an inferior option. Even in Hong Kong, where China has expanded its grip on power this year, leader Carrie Lam shifted course on December 23rd and said residents can choose whether to take the Pfizer, Sinovac, or AstraZeneca vaccines. But many questions remain about the vaccines. Researchers want more data on how well they protect older people, children, pregnant women, and immunocompromised groups. They also want to know what types of immune response the jabs trigger, how long protection lasts, and how well they work against emerging variants. And that's all for today. Thanks for watching the video. Give this video a big thumbs up and share your thoughts in the comments below. For more exciting videos, subscribe to the channel and hit the bell icon.